Folks here in Hannibal are on the front lines of helping Missourians in crisis get the care they need to get healthy, stay safe, and start down the road to recovery. And for the work they do each and every day, we thank them.
Governor Nixon met with caregivers at Mark Twain Behavioral Health to announce an expansion of Missouri's Strengthening Mental Health Initiative.
2 years ago, we saw that Missourians with untreated mental illness were putting a significant strain on their families, their communities, and local law enforcement. Without access to the appropriate care, these folks cycle in and out of emergency room and jails, not the appropriate environments for quality mental health care.
The governor's budget for fiscal year 2017 includes an increase of more than $40 million for mental health services.
Too often, Missourians in crisis, especially young adults, can't afford the long-term treatment or medication they need to get better and stay on that road to recovery. That's why this budget also includes $5.4 million to launch a crisis prevention program for low-income Missourians between the ages of 21 and 35 with severe mental health and substance abuse disorders.
Right now, demand is greater than we can meet, and so we've had to put some of our patients who call in on a waiting list until we can get them in. And I think this increased funding is going to allow us to hire more staff and therefore get people off the waiting list and get them really in with the expert staff that they need to have to help them with their treatment.
To learn more about Missouri's Strengthening Mental Health Initiative, visit governor.mo.gov.
My budget for the fiscal year 2017 next year, as part of a historic investment in services for Missourians with developmental disabilities, will include $5 million for a major expansion of the Thompson Center for Autism. This expansion will mean more cutting-edge research to identify the most effective treatments and more opportunities for community engagement.